Good morning. Welcome to Salina Regional's Morning Medical. I'm Mike Maddock from the Marketing Department at Salina Regional Health Center. This morning's program, I have with me Dr. Christopher Graber and Dr. Boo Hodges from Salina Women's Clinic. Thanks for being on the program.
Our pleasure.
Thank you. Guys, we've heard a lot about DaVinci. You guys have been doing DaVinci surgery for a while, which we'll talk about a little bit here, but I wanted to maybe at least start out talking about a new service, the single site. And with that, being a layman, not knowing much about it, why don't you tell us and the viewers a little bit about the single site?
Sure.
Yeah, Chris and I have done over 400 DaVinci hysterectomies here in the last 4 years, which currently puts us second most in the state of Kansas in the last 4 years, which I feel really good about. And I feel really strongly, and Chris feels really strongly, that if we do enough of them, we would stay well practiced and do good work. So I feel very comfortable with the 4 puncture technique, which we've been doing. But the single site is really amazing in that we can still do everything we want to do inside the patient through a 1-inch incision underneath the belly button, which is radically different than anything we've done before. 6 years ago, we're doing big incision hysterectomies. Then we got down to 4 small incisions, which are great. But now if we can do it all with 1-inch incision, that's spectacular.
We really have to try and decide which is more appropriate for a patient. Sometimes one technique is going to work better than the other, depending on the surgery, depending on the patient. But the difference between the big open incision and either the 4 small ones or the 1 small one makes a huge difference for recovery time. Patients are able to bounce back, get back to work, get back to their families a whole lot faster. The downtime is simply a whole lot less.
And it really helps job satisfaction for Chris and I, because making rounds, seeing people after the surgery in the office is so much more fun. Because instead of people coming in still hurting really bad, barely functioning like we did 6 years ago, at say 2 to 3 weeks out, they're back fully employed, having minimal pain and doing really well, which is fun. I mean, I hate to say surgery is fun, but it really is fun for us to see them do that well every time.
To see the patients jump back and bounce back that quickly, 2 weeks back to work is not unheard of at all when we're doing DaVinci surgery.
And the single site, I think, hurts even less. You have less incisions. Also, things we like a lot too is less chance for infection, less bleeding risk, things that you want when you do a hysterectomy.
Technology, and we're so glad to have a couple of artists working that technology, so thank you very much. For more information on the DaVinci surgeries or any of the women and children's services, please visit srhc.com and like us on Facebook for the latest news and updates.